Migraine medications for a breastfeeding patient. If the use of Imitrex in the form of a spray is not appropriate for the case of a breastfeeding patient, it is also possible to propose taking such sumatriptan as Migraine, which is distributed in the form of tablets. However, it is important to accentuate the fact that the patient should follow certain prescriptions and recommendations while taking this medication to avoid increasing the concentration of sumatriptan in breast milk. Therefore, it is recommended to breastfeed an infant before taking a drug. While speaking about other types of medications that are used to cope with migraines in those women who breastfeed their children, it is important to focus on using simple analgesics, such as acetaminophen, Tylenol. According to researchers and clinicians, acetaminophen is compatible with pregnancy and breastfeeding because of minimal side effects and low toxicity. Therefore, if the patient has some side effects associated with consuming sumatriptan, it is possible to recommend using acetaminophen as an effective medication to cope with symptoms of migraines. However, some patients note that the effectiveness of acetaminophen is not as high as that of triptans. Therefore, for this case, triptans are recommended depending on the analysis of their effectiveness and compatibility with breastfeeding. Still, if medications that belong to the category of triptans are discussed as ineffective or inappropriate in this case, it is reasonable to recommend the treatment based on the use of acetaminophen. Suppose acetaminophen is ineffective in coping with symptoms of a migraine in a breastfeeding patient. In that case, it will be important to evaluate the appropriateness of other medications depending on their toxicity levels.